I'm Enrique Pérez, Associate Professor of the University of Paris and Head of Endoscopy of Georges Pompidou European Hospital in France. I discuss with you today about our recently published article entitled Transenteric ERCP via US-guided anastomosis using lumen-apposing metal stents in patients with surgically altered anatomy. Why did we feel to do this study? Well, the treatment of biliary diseases in patients with surgically altered anatomy is very challenging and has evolved very importantly in recent years. Historically, surgery and percutaneous approaches has been described in the literature with good outcomes, but high morbidity or a limited clinical success in selected indications. And therapeutic endoscopic ultrasound and also endoscopic approaches has been evolving with more and more evidence in the literature. On the one hand, we have more and more articles and research papers focused on patients with Roux-en-Y gastric bypass or previous pancreatic duodenectomy, with the endoscopic approaches coming out as very effective from technical and clinical success point of views, as well as limited adverse event rates. On the other side, we have also more and more evidence regarding the US-guided anastomosis using lumen-apposing metal stents, LAMPs, in a very wide number of scenarios, so patients with, again, surgically altered anatomy in terms of safety and effectiveness. But however, other surgical configurations such as Roux-en-Y total or partial gastrectomy or Roux-en-Y hepaticogynostomy has not been evaluated in the literature in large studies, and there are few data regarding the role of therapeutic US in this very particular setting. So in our study, we conducted a multi-center research with focus not only on patients with gastric bypass that were excluded, but particularly in those patients with surgical anatomy such as Roux-en-Y total, partial gastrectomy, or hepaticogynostomy. We have excluded patients with gastric bypass and afferent limb syndrome. For those patients, we have also previous papers already published stating that therapeutic US is an effective approach. We analyzed the feasibility and also the safety of ED, transenteric ERCP, with focus on therapeutic algorithm in these cases to identify the afferent limb. And this was one of the main strengths of our paper. Indeed, the identification of the afferent limb remains very challenging, and there are different approaches endoscopically, but also fluoroscopy driven that can be used in this selected scenario. This comprehensive approach of the technique is one of the major points again of our study, including 94 transenteric ERCPs in 55 patients. The most frequent anatomy configurations were Roux-en-Y gastric Roux-en-Y hepaticogynostomy, and a prior biliary drainage was done in half of cases. Of course, benign indications were most common because we have other different approaches by therapeutic endoscopic ultrasound in patients with malignant indications. And we have good outcomes regarding the safety and the effectiveness. Regarding the techniques to identify the biliary limb, US imaging alone and US-guided puncture of the afferent limb with reflux opacification of the hepaticogynostomy were the most common. Technical success was very high, over 85%, and the overall adverse event rate was about 20%, with a 9% LAMPS-related adverse event rate. In conclusion, the ED technique, so the transenteric ERCP via this US-guided anastomosis, offers a new and effective approach in patients with surgically altered anatomy other than gastric bypass, and particularly in benign indications. Indeed, one of the advantages of the technique is to repeat different procedures to analyze the papilla area for those patients presenting with a native papilla, and a comprehensive approach with a dedicated therapeutic algorithm seems mandatory to understand what is the best technique to identify the biliary limb, and not only to identify the biliary limb, but to understand the distance between the US-guided anastomosis and the native papilla or the hepatico-jejunostomy. What should come next? Well, for sure, this large series will give much more evidence regarding this very selected scenario, but we will probably need more dedicated studies in selected settings, such as the different anatomical configurations and also the different techniques we have already described for identifying the biliary limb. This will be or should be one of the main critical points of next studies coming out next year. Thank you.